Okay, we're going to do 10 questions. I just made this up, by the way, about med school. 10 questions about med school. What was the weirdest thing that you remember happening in med school?
Oh, there were so many. I would say one of the weirdest was we had professional actors to do rectal exams on. And it was San Francisco. So they were wonderful gay men. And one of them said, I said, what can we call you, Mr.? And he goes, just call me the Admiral. And then because I couldn't, I couldn't reach all the way to the tip of the prostate, and he knew it. He said, you didn't get the tip of the prostate, did you? Or did you? And I'm like, do I lie to him? Do I not lie to him? Like, what do I do? And I said, Admiral, I was unable to reach the distal most part of the prostate. And he goes, well, glove up and go in again. And that's when I realized, like, it was weird. It was one of the weirder things, but also the patient knows what's up. Like, listen to the patient, right? Yeah. But yeah. So that would be my answer. Although I've got 20 more, but you don't want to hear them.
Yeah, me too. I could go on and on probably. If I started talking about it, I could be still talking in 2 hours. I'll give you one quick reflection. I might have told you this story. This is one of the this didn't happen to me. It happened to one of my friends. We did the same sort of thing where we had standardized patients, even physical exam standardized patients for pelvic exams, for rectal exams, and so forth. So we had gotten through that, but for some reason, and I don't remember what it was, but only some students were able to actually learn the prostate exam on a standardized patient. And I wasn't one of them, and a lot of people weren't. I think they didn't have enough of them or something, okay? So a lot of students went to like their urology rotation or working with a urologist or a primary care doctor had never done one, right? So one of my friends who did not know any better was with a urologist, and the urologist did a prostate exam on his patient. And he asked the patient very graciously, do you mind if the student does this now? He's here to practice. And he said, sure, go ahead. And then when the student did it, the patient wailed in pain and said something like, what in the hell are you doing back there? And the student kind of backed out real quick. And the preceptor looked at him like in a weird way, but he didn't say anything until they were out of the room. They left the room and he said, you only need to put one finger in. And the student was like, oh my God, the only kind of sensitive exam I've done was a pelvic exam where I did a bimanual exam. They told me you put two fingers in, you try to feel the ovary, which you'll never feel. But so he literally, it's like the little bit of communication could have happened that would have prevented that, but he didn't know. So
wow.
Right? Isn't that wild? Like, oh my God. So talk about embarrassing. I'm sure he's still in therapy over that. I can imagine.
Med school is a trauma. It's a trauma, man.
Total embarrassment.
Yeah.
Okay. Question number 2, med school question number 2. What was the best day of med school for you?
It was the day I did the graduation speech for my class in the end of 4th year. That was the best day because, actually, no, it's a tie. It's a tie with the 2nd year class play, which me and my buddy produced, and seeing all our classmates come together, do this really funny, hilarious thing, everybody working together when we were really competing for grades and all that by 3rd and 4th year. That was it. I felt so much pride and connection to everyone that day. And the same thing at the graduation speeches. It was a sense of connection.
That's awesome. Yeah. I've seen your graduation speech, or at least a portion of it. You've posted that somewhere.
Yeah, it's on YouTube. Okay. Yeah.
On YouTube. How about the play? Do you have that up anywhere, or is it
sadly no? We have like old VHS cassettes of some of it, but the guy who eventually became an ER doc, who was supposed to record it, screwed it up, and so we have no video of the things that weren't pre-recorded. But one of the pre-recorded one was the Doxa Hazard, where we took a gurney and we launched it off a ramp in slow motion. It was like yeehaw! 2 guys on scrubs riding on it. And we almost broke our bones, but it was a joy because we had Daisy Doc doing chest compressions in Daisy Duke cutoffs, which was...
I love it.
Yeah.
That's great, man. All right. Question number 3. What was the most interesting and revealing, or as far as like your confidence level of being able to do it, procedure that you learned to do in med school?
Oh, my favorite procedure was paracentesis. And the reason paracentesis is where you put a needle in the abdomen of somebody who has fluid in the abdomen that's abnormal. It could be liver failure, it could be cancer, there's different things that can cause it, heart failure. And what was so wonderful about it wasn't technically that demanding, but if you screw it up, you could kill someone. So it requires a degree of skill, but it's hard kill somebody. And once you remove fluid, often people's mental status would improve instantly. So I would have these, Vietnam vets who had hepatitis C from the days in Vietnam, and they would come with, on Thanksgiving with like, the metabolic abnormalities and their fluids. And so you have to remove the fluid, test it for infection. I would take off a couple liters. The guy would suddenly come back to his senses and be like, where am I? What's going on? I'd be like, it's Thanksgiving, bro. Happy Thanksgiving. And then you totally bond. It was just so satisfying.
Yeah, I completely agree that paracentesis and thoracentesis, both. Thoracentesis, it's like somebody can't breathe, and then you drain some of that fluid out of their pleural space, and they just feel like they're breathing again for the first time, and it's pretty amazing.
It's great.
Okay. So question number 4, what was your best subject in medical school?
It was GI physiology, actually. Yeah, I was quite tuned into physiology. And my worst subject, actually, well, the one I didn't study for very well was anatomy. I just didn't have the spatial memorization for anatomy. And the problem was it didn't connect to a story for me as well as like physiology did, where there was the story of the human around it. With anatomy, it felt very kind of like the left brain had taken things and categorized them and made them explicit, but they didn't connect in some way. And that's what I think I struggled with.
Awesome. So that's 5 questions. You answered the 5th question I was going to ask. Number 6, what was your favorite rotation in 3rd year med school?
In 3rd year, if I'm being honest, it would have been psych, actually. Yeah, psych was awesome because it was inpatient psychiatry, Langley Porter Medical Center, UCSF, the sickest of the sick. I mean, these people were really ill, and yet you could feel the underlying humanity was there. They were trapped in their mind structures. And there was one guy who was like a 60-something-year-old guy. This was in the 90s, so I don't know if I'm violating HIPAA, but there's no names anymore, and I'm sure he's deceased. But he had obsessive-compulsive disorder that was so severe that it was debilitating him. And they had notes from the 60s from his psychotherapist in his chart where you could see how they kind of managed it in the days prior to medication. And this guy would say things like, because we tell him, just go ahead and make explicit whatever your thoughts are, your intrusive thoughts, whatever, when we were interviewing him. And he would say things like, to me, like I'm like a 23-year-old, whatever, medical student. He'd be like, I'm thinking about you right now and your penis. And I'd be like, of course you are, sir. Of course you are. So, stuff like that. But it was just a really deep dive into how the psyche can really torture us, when things go wrong.
Yeah, absolutely. I would say exactly the same thing. My psychiatry rotation was my favorite in med school. I did it at the State Psychiatric Hospital on maximum security by request, but it was the same thing. It was just massive amounts of psychopathology or pathophysiology that's based on mental illness, but with also sometimes a criminal element, but not always. The interesting thing about it that I found was how just like me or you, the patients really were for the most part. Really, you put somebody, and my heart really just went out to a lot of these guys, right? They were all men where I was, and you take someone who grows up in an abusive environment, never has a good role model, and maybe all their role models are actually abusive to them. Ends up with a head injury somewhere along the lines. They have impulse control, probably has learning disabilities, and they're just magnified by low socioeconomic status and abuse. Then they end up, homeless to various degrees, even in young ages. Then they're end up in trouble with the law. They get beat up by the police. They end up in and out of institutions. And then on top of all that, they have bipolar disorder or schizophrenia. How in the world is that person could ever be expected to live, function a normal life? They have no internal structure of organization around relationship and work ethic and problem solving. And yet, at the core of them, they were sweet people, very genuine, sweet, many of them very sensitive people. And And was very interesting in that environment is they actually functioned pretty well in that environment because there was so much structure.
Yeah.
They had this. My attending was a psychiatrist, and he was a forensic psychiatrist. He had to go to court a lot and stuff. He was more hands off. He did the meds and things like that. But there was a woman there who was this petite little psychologist, and her job was to structure all of the reward system there and the whole environment. She was so good at it, and they actually did really, really well. And they're just good people. I played chess with them. They'd kick my ass. The stories they would tell were just fascinating and tragic. But I loved my psych rotation as well. It was just it's really something to be able to share that with people.
Yeah, I wonder, because we both share this same realization that the psychiatry thing was our favorite rotation. It's interesting that neither one of us drifted into psych. I didn't see myself doing it as a career. My mother's a psychiatrist too, and I just didn't see it.
Yeah.
But it is interesting.
I would sit there and talk to the patients, and I can't tell any details here, but I remember one guy in particular, a young dude, and I sat down and just talked to him and really went through what happened, how he got there, what's been going on in his life, and he told me, he's like, man, he said, actually he told me this before I left. He said, I want to just tell you something, you're different than these guys. He goes, you really care about us, and I can tell.
Wow.
Wow. And I was like, wow, because I knew my attending, my preceptor, I knew he cared about them, but he was pretty hands off and stuff. And even my attending told me, he said, it's interesting the relationship you have with these patients. He said, you're not doing psychiatry though, you're doing psychology. You're therapy wise, So that was kind of my takeaway is I wouldn't have wanted to necessarily do the drug side of it only.
Right.
And that I liked talking to the people and sharing, their stories and their challenges in life and just connecting and offering compassion, really.
It's funny. That's what my mom tells me she liked about psychiatry. She would do the meds just because she had to, but it was really the sitting for an hour. And in those days you could do that with the patients and knowing their stories. Yeah. And she had patients for years and years, 30 years. Yeah.
It felt like a privilege just to interact with people like that, to be honest.
Absolutely. I mean, they're there at their most vulnerable and they're letting you be there, and it's this beautiful dyad, and yeah.
Okay. And so what is question number 7? What was your least favorite rotation? OB-GYN. Just joking.
I thought you were reading my mind because I know you have ESP, Angela. It was OB-GYN. And the reason is, it was my first rotation, and it was San Francisco General Hospital. And I may have told this story publicly, but it was traumatic. It was the first time I had to take 24-hour call. It was actually 36-hour call. And as a medical student, I'm a third-year medical student. I still didn't really know how to do a physical exam. I was still scared of the lady parts. And the patients it was a county hospital, and there were patients that it was just these patients needed people. And then they throw me in there, and I'm like, oh my God, all I would do is try to just connect with them, but I didn't have the skill set in OB-GYN to help them on that level. Delivering babies, I remember the resident was saying, just put a little gentle traction on the umbilical cord, and he goes, okay, I'm like this, and he goes, yeah, just keep going, maybe a little more, and the cord avulsed on this, poor lady, and that means it snapped off the placenta, and the placenta retracted back in, and they had to go digging around, and she was screaming in pain, and I'm like, this is not why I went into medical school, to torture people like this. It feels terrible. I had a real existential crisis where I was like, medicine is not for me. I would look at the janitors. This is when I got really depressed, actually, third year. I'd look at the janitors and go, those guys have a good job. It's a 9 to 5. They know what's expected of them. It's structured. It isn't all open-ended. No one dies if they don't clean the floor, and they seem happy. It was bad.
Mm.
Yeah.
That avulsed cord, that's like the nightmare of a med student, isn't it? And you just, not like you did anything wrong, it just happens on occasion, but boy, just the fact that you're right there, it just makes, I know that guilt feeling and that second guessing yourself and just going, oh my God, what happened, and
yeah, it's the worst. It's the worst. Yeah.
So we have 3 questions left?
Okay. Yeah, you were at 7, yeah. It's maybe 2 left.
Okay. So question number 8. What, if you were to do it over again with medical school, what specialty would you go into, or if it's not the same one?
I would do hospice palliative care, honestly. Yeah, I think with what I know now, that's where I would do the most good, because it's exactly what we were talking about. You get to know people's stories, you honor them, you witness suffering, you help with suffering, you witness the end of life, and you treat it as important as the beginning of life or the middle of life. And so that would be, being the enemies of suffering, I think, is what I call them. That's what I would probably do. Yeah.
Awesome.
Would you
Okay.
do something different?
I would probably not.
Yeah.
I think it was a good choice for me. It worked out really well.
Yeah.
The other things I would consider like interventional cardiology, maybe psychiatry, maybe if it was the right job and position. Yeah. All right. So I actually have three more questions because I just thought of some great questions that actually your viewers would probably like to hear you answer. So for anyone who's watching this, who is pre-med and actually getting ready to start, they've already decided they're going to medical school, they've done their MCATs or whatever. What piece of advice would you give someone who says, "Hey, I'm going to start med school, in July 1st or whenever it is"? Just from your experience, both in medical school and then all the physicians you've come in contact with your interviews and discussions and your knowledge base and experience, what would you give them as a guiding principle?
It's so hard because you almost have to stumble into it with beginner's mind to some degree and find your way. And I think to a degree that'd be my advice, is like just go in like you don't know shit, because you don't. You really don't. Everything you think you know is probably not correct. And in fact, everything they're going to teach you, half of it's going to be proven wrong, and they won't have the courtesy to tell you which half. So question and have curiosity and keep looking, and also have an openness to the experience that you go in with a certain set of assumptions. What if those change? What would happen if you thought you were going to do psych and now you want to do anesthesia? How will you feel about that? Will that threaten your sense of identity? How will your parents feel about that? Does it matter? These are the things that you have to constantly inquire into. And I think that kind of thing is important. And then form your set of relationships and friends and keep them close, because they're going to be your rock throughout, and they'll be your friends when you're 50 and 60 and 70, because that's just how it is. You're going to find those relationships are very long lasting because you've been through a crucible that very few people have been through, and that commonality helps bind us together.
Yeah, man, I completely agree. Very, very well stated. And yeah. I almost cringe a little bit to think about being in those shoes right now.
I know, right? It's so.
But it's such a rite of passage, the whole thing, and then residency, of course. So the 10th question: what would you tell somebody who's in medical school now, as a fourth-year student? Let's say they've matched or whatever. They already know what they're going into, but they're going to leave medical school. They're going to go out and start as a resident. What piece of advice might you give them?
Yeah, I would have to say, like, don't take things very personally when you do this. This is a hard route. You're going to have a lot of sleep deprivation and all that. And when you're feeling bad about something, it has nothing to do with you. You're put in very impossible circumstances, and you do the best you can, and stick it out and look for support. And again, those relationships matter. So that's really it. Is like find that lift that gives you the support that you're going to need through the physical challenges of this, because it's just physically demanding work as well as mentally and emotionally. And what happened to me, I think, in residency is something that I think you can be aware of and be tuned into, which is a butt ton of emotional repression. So you're just constantly shoving these very difficult experiences down and going, I can't feel that right now because I got stuff to do. That's fine. You can do that in the moment if you have to, if you're trying to get through a shift or something and you don't want to fall apart. But you better let yourself feel it at least that next day or the next day you have a day off. Because if you don't, it starts to build, and then suddenly you have a wall around yourself where you're feeling nothing. And that happened to me, actually. And it was hematology oncology, actually, second year, that finally broke through the wall, where I was able to, I think I'd gone somewhere, hung out with some friends, and I finally was able to feel all the suffering of others that I was repressing and not allowing myself to feel. And man, it was cathartic. It was horrible, but it was necessary to retain the connection to the humanity that you're treating, right? You're not treating problems, you're treating a human being underneath it.
Beautiful. Last question. Question number 11. A resident who's just finishing residency, or a fellow who's finishing their fellowship, and they're getting ready to take their job. They're going to go out there and work. Training's done. What advice would you give them as they move into their career?
I would say this. The current system of medicine is very reductionist, left brain, corporate, hierarchical, and so on. You're going to feel that. Or you may not. You may get lucky and you'll find a space where that doesn't exist. But I'd say this. you still have to try it. You still have to go through it, and you still have to do your best. And if you find that that is not a fit for you, or you're suffering so much that you don't see that that's going to get fixed by anything you do, it is incumbent on you to wake up to that and go, okay, then I'm going to go shift direction. Either I'm going to go somewhere else, or I'm going to try something else. And they will tell you, oh, you'll never find a job like this. Oh, you won't be hireable if you leave this. Oh, this, that. That's all a bunch of crap. You have to listen to what your deepest intuition is telling you about that. And often it's family members will reflect this to you, like you need to listen to them. And, you know, they'll say you're becoming an asshole or whatever because this job is killing you. And to some degree that happened to me actually. And at that point you can change direction. There's nothing trapping you in that job. It may feel like it, but that's the story you're telling yourself. So be flexible in that way. But it is a very exciting time. You're going to get independence. You're going to be learning constantly. So be open to that as well. The fact that you never know what you're doing. You're always learning.
Yeah. Yeah. Man, great advice. I'll add for anyone who's watching this, basically a reflection of part of what you said, but just to emphasize the point. I can tell you this from my own experience of 10 years working as a independent physician, anesthesiologist, but also being on medical staff and chief of medicine, things like that, and just seeing, you know, how things can play out and all that. I think a really important thing that some physicians are good at and other ones just aren't is really trusting your peers, trusting input from your peers. I did a residency before anesthesia in a family medicine, and my attending in family medicine said something that always stuck with me. He said, you should be really grateful for any feedback you're getting in residency because it's not punitive. When you leave residency, most of the time you get feedback, it's going to be legal, punitive, a lawsuit. And he said, so you should be grateful if anyone tells you, hey, maybe write that note a little clearer, or hey, I really would not, you know, work that way around this particular type of patient, or whatever it is. Like, just really be willing to absorb outside influences and your colleagues who all have something valuable to say and to add to it, and be open to feedback. That will save you endless heartache in medicine. So anyway, that's probably my advice.
That's great. That's great advice. That's great advice. And I think it dovetails right into my residency advice of don't take anything personally. Like, that feedback is there to improve your process. And like you said, it's not punitive, you know, and if you take it as punitive, that's going to make it difficult.
It does, because then people at some point might not want to give you feedback, and they'll just let you get through residency, and you'll have blind spots. Another analogy is that flying the airplane. When you give feedback, the residency director would say this as well in family medicine. He'd say, I like to give feedback like when you're flying a plane, you're watching all the instruments, you want to get constant feedback from all the instruments. It just keeps you flying straight, and you know what's going on. It's not a problem. It's not personal. It's not a disaster. What you don't want to do is put a paper bag over your head and let the plane fly itself for 25 minutes, not paying attention to any feedback, and then pull the bag out and see that you're headed for the ground at, like, you know, ungodly speed and you're 1,000 feet off the ground. That's not the kind of feedback you want. You want frequent, simple feedback, and being open to it and adjusting as you go. It's simple, you know. Anyway.
That's great.
So that's the end of the bonus round.